Hi, I'm Grover Shanti. I'm the founding director of the Mental Health Co-op, a residential program for adults in Houston, Texas. While you can find information about our program on our website located at www.thementalhealthcoop.com, I thought it might be helpful for you to understand some of the therapeutic techniques that we use at our agency. As you might know, the agency provides treatment services for clients who are able to respond to new interventions and remedial work around the impact of their mental illness on their social, emotional, and sexual functioning. Some of the techniques that we use are based upon the ideas I presented in my book, which is called Defining Feelings, Understanding Emotional Arousal and its Impact on Our Behavior. Other techniques that we use are incorporated in a new teaching technique developed at the University of Pittsburgh called cognitive enhancement therapy. Now, both of these techniques involve cognitive work, that is, reprogramming the brain so that the individual learns how to deal with either problem-solving skills that have been interfered with by their mental illness or the social emotional kind of factors that cause them to appear dysfunctional in their various social roles. My model is to look at how did the individual develop skills, if any, throughout the whole lifetime experience. Cognitive enhancing therapy is designed to help the individual reprogram the way that they think and do problem solving. Now, while I don't expect you to be able to read everything on the board, but the fact is that when an individual comes to an agency like the Mental Health Co-op, we want to look at three factors. First is the biological impact. That is, what kind of an illness did the individual have, how much of this is biochemically based, and what can be done to stabilize the biochemistry so that individual is not impacted in a negative way by their thought disorder, their mood disorder, or their behavioral disorders. The second factor we want to look at is what kind of behaviors has the individual developed that are not working well for them. Addictive disorders, whether it's substances or addiction to religion or addiction to food, some kind of OCD symptoms that make them and the individual be involved in power control issues about their life, etc. The third area, in addition to biochemical, in addition to behavioral, we want to look developmentally, what skills has this individual developed? And this is where cognitive therapy plays a major role. In order for us to understand the impact of developmental gaps on a person's functioning, for example, the problem of transitioning from adolescence to young adulthood or from young adulthood into full adulthood, we need to know what skills the individual brought to the situation at the time of the onset of their illness. Surprisingly to many of the families and professionals who we work with, most of our residents come into treatment with skills at the 8, 9, 10, 11-year-old level. That is the pre-adolescent level of skills. The skills of learning, the skills of being creative, the skills of doing, skills of learning how to play an instrument, how to dance, how to do gymnastics, how to do algebra. But they do not have the skills in terms of identity, understanding their own emotional arousal, being able to cope with the anxieties that they experience when they're trying new experiences such as in dating or other adolescent kind of exploration. So the individual who comes to adolescence or young adulthood in a compromised developmental state is going to have difficulty, significant difficulty, transitioning into the next stage of their life. Now you add to that the impact of the biochemical, or you add to that the impact of behavioral disturbances, and you get an idea of how complicated the healing process can be for any individual. What I've put on the board is just an example of how we would look at an individual. First of all, a person comes to us with symptoms of an illness or with consequences from an illness that they've had for an ongoing period of time. So a person can be at point X and they may want to move towards point Y, which could be independent living or forming relationships or developing positive leisure time skills. Most people try to go directly from where they are to their goals. The mentally ill do not have that option. The mentally ill have to learn how to accommodate to their illness in the process of moving towards their goals. This has several specific steps. The first step is understanding that they have an illness, accepting that they have an illness, moving out of denial. And you'll find that many clients, when they come into treatment and we start emphasizing their responsibility for handling their illness, they exit healing. That is, they move away from healing, not towards their goal, but completely away from what we would want them to do. The reason they do that is they become depressed, or they become anxious, or they have such a lack of skills that they feel this is an impossible task. What is the impossible task? That is healing, growing, changing. The second thing is that once a person at least accepts that they have an illness and that there's going to have to be some remedial work done, they have to develop skills. They have to develop new skills. That means they have to learn how to trust. They have to learn how to communicate. They have to learn how to study about themselves, how to analyze their own issues. Many clients, again, they leave treatment at that point because they get a feeling of frustration. They get a feeling of inadequacy. And this is because they haven't completed normal developmental steps in the earlier growth processes. Finally, the individual has to start making choices. And for many of the mentally ill, especially young adult mentally ill, they want to make choices, but they want to make choices based upon their skills, their knowledge, not on the basis of what is actually needed to manage their illness, to heal their illness, and to allow them to progress in their social, their emotional, and their sexual functioning. Then the person has to, of course, eventually make changes. If they have an addiction, they have to give up the addiction. If they're in denial, they have to give up the denial. They have to begin to focus on the types of issues that are impacting them. Many people think that the mentally ill who come to our agency are dominated by the biochemical factors in their illness. The bipolar person, of course, has a disturbance of mood, and there is a biochemical basis. But this can be easily stabilized either with medication or a combination of medication, understanding, and cognitive growth. But many times people put all the emphasis on the medication factor. Many of the clients who come here have developed horrendous types of behavioral responses to being ill. They're angry, they're raging, they're self-mutilating, they're suicidal. They're completely rejecting any healing process. That behavior has to be dealt with before the kind of emotional growth that I'm referring to it can take place. All individuals, in order to function in normal or normalized kind of adult or young adult processes, have to have a sense of wholeness, a sense of integrity, a sense of being a contained or complete person. Many of our clients have not completed that task, do not bring a sense of integrity or wholeness to the healing process. That has to be addressed. Again, I'm only trying to demonstrate in this little discussion how the cognitive processes, whether it's retraining the brain in problem solving or retraining ourselves in terms of controlling behavior, impulsivity, self-destruction, that these are all a part of the cognitive therapies that are provided through the Mental Health Co-op. If you have additional interest in our services, then please feel free to contact us at our main office, 713-524-8705, or make contact through the internet at www.thementalhealthcoop.com.